So as Ron was moving into that, I did not expect you to finish 15 seconds early. Wow, pretty amazing. Brian, please pick up.
15.
Good afternoon, everybody. I want to thank the Roundtable for organizing this wonderful day of conversation. And very pleased to come after Ron because I'm going to talk about a leadership program that seems to be on the same wavelength in terms of what we're trying to do to help build a community of leaders who are well-trained and prepared to work across sector as well as more deeply within their own sectors of work. So I'm going to attempt to describe this in, I guess, 10 minutes in the 15 seconds that Ron left. Before I begin, I need to acknowledge a couple people. One is Dr. Mary Joan Ladden, our program officer from the Robert Wood Johnson Foundation for the RWJF Culture of Health Leadership Program. We also have a member of our National Advisory Committee here, Terry Allen from the Cuyahoga Commission on Health. I want to thank both of them. This program is now recruiting its fourth class of leaders, and we wouldn't be where we are now without Mary Joan and her vision, Terry and our wonderful National Advisory Committee. So it's still a relatively young program. We have not graduated our first cohort of leaders yet, but we're so excited about the potential of these leaders to do amazing work in their respective communities to build a culture of health. So that's what I'm going to talk about. As many of you know, a few years ago, the foundation sunsetted some of its legacy leadership programs, and I think it's fair to say that the foundation's investment in leadership is probably the most significant investment that we've seen in the health sector. But the foundation gets it, that we also need to reach and train leaders in other sectors. So the four new programs include the Health Policy Research Scholars, graduate students who are committed to working on issues, particularly for underserved populations that face inequities. And so they're being prepared to be better able to shape their research to address policy questions. Interdisciplinary research leaders, an innovative program that pairs researchers with community members to form more cohesive teams of collaboration across communities and campuses. The Culture of Health Leaders, which I'll talk about, and the Clinical Scholars, which it also is an innovative program connecting, again, clinical professionals with community members to address wicked problems in those settings. We, the National Collaborative for Health Equity, my organization, we're very pleased to co-lead this effort with my colleagues at Common Health Action, and Natalie Burke, the president and CEO of Common Health Action, serves as the other co-director of this program. But we've enjoyed partnerships with a number of very innovative groups, the Institute for Alternative Futures, the Center for Creative Leadership, the Leadership Learning Community, my friends with the American Planning Association, which you'll hear from shortly, and the Build Healthy Places Network, which exists to connect public health with the community development sector. The Culture of Health Leadership Program is a new and innovative effort to build a new kind of leader. It's a 3-year intensive advanced leadership development program where we provide formal leadership training along with professional coaching as well as peer coaching. And we challenge our leaders to conduct a strategic initiative, evidence-based work that changes conditions and organizations and communities. So we're orienting our folk to be thinking in terms of systems and the structures where we begin to tackle the roots of inequity. We collaborate across sectors, as I mentioned, but this work is very much grounded in principles of equity and social justice. So equity, diversity, and inclusion training is foundational to the training in this program. For the past 3 years, we've selected up to 40 leaders for a total of 120 leaders in the program currently. These are leaders coming from a range of disciplines, perspectives, sectors. It's been very important for us to recruit, for example, from the arts community, from the community of education, from people working in policy spaces. One of our leaders in cohort 3 is a firefighter from Detroit. So I'm very proud that we're able to attract leaders who reflect these perspectives and disciplines. And we are now in the majority of the 50 states. There are only a few states where we don't have a presence. These are the locations of our leaders across the first 3 cohorts. And we're very much hoping to have a presence in all 50 states as well as the District of Columbia going forward. So our leaders are remarkable people. They come into our program with well-developed leadership skills. Our effort is to help accelerate that leadership just a bit further, allowing them to engage deeply with their communities to realize the vision of healthy, equitable spaces. They are highly motivated, and even though they possess tremendous expertise coming into the program, they've got to be ready to learn and open to learning new concepts and to helping each other learn. They embrace complexity and risk-taking, and they're ready to influence the next level with their leadership, being able to network more broadly with other RWJ leadership alums and to be able to extend that work through those networks. Like the program that Ron described, we have a number of areas of mastery and competencies associated with the 4 areas of mastery, which are mastery of environment, being able to understand both historic and contemporary circumstances that we're challenged to deal with in terms of the political and social environment, mastery of relationships, being able to bring the best out of others, mastery of change, being able to sustain the kinds of systemic changes that we seek, and mastery of self, being able to have awareness and discipline to be able to exert your leadership. At that nexus of those 4 areas of mastery, that's where we want our leaders to be able to think and to influence others through their decisions, behaviors, and actions. Here's a brief snapshot of the program. In the first year, we focus on self and relationships, those 2 areas of mastery and the associated competencies, and we do so through in-person training, virtual learning, coursework, as well as through coaching and peer coaching. In year 2, we focus on the areas of mastery, environment, and change. And finally, in year 3, when our leaders begin to implement a strategic initiative in their communities, they're focused on all 4 areas of mastery: self, relationships, environment, and change. Our leaders commit 32 to 38 hours per month across the 3 years. So it's not a light commitment at all, and the leaders recognize this coming in to the work. In year 1, as I mentioned, there's an intensive focus on self and relationships. In the interest of time, I'm not going to go into great detail except just to highlight the fact that the executive coaching and peer coaching are critical to this phase, as well as assessments such as a 360 assessment that allows the leader to get feedback from supervisors, peers, people that the leader may supervise. So it is eye-opening and intensive learning. Year 2, as I mentioned, the focus on change and the environment, and here are some of the methods used to help leaders acquire those skills through executive coaching, peer coaching, and again, ongoing assessments through our partnership with Center for Creative Leadership. And then year 3, integrating all 4 of those areas of mastery and beginning to exercise one's leadership skills through the strategic initiative. These are some of the competencies, the 16 competencies associated with the 4 areas of mastery. And again, in the interest of time, won't go into great detail, but in short, mastery of self includes things like self-management, self-regulation, self-insight, and self-development. Mastery of relationships includes the ability to build collaborative relationships and to bring out the best in people working across lines of difference. Mastery of the environment includes things like acting and thinking systemically, being able to distill information, often complex information about complex problems that requires a good, sound judgment to be able to make sense of that information. And then mastery of change, being able to influence and lead others, being able to communicate and to sustain the kinds of changes that we're seeking. So, great. I left a little bit of time on the clock. Want to encourage folk to visit our website. There's an email address with information about the program that comes directly to us. And look forward to the conversation because I think it sounds like there's some interesting areas of intersection across the areas that we work. Thank you.